As foreigners, we are always targeted. We are mugged and our money and cell phones are stolen. Women are sometimes raped.
This man fled the hardship and poverty back home in the hope of a better existence here in Johannesburg. Thousands of migrants, mainly from Zimbabwe, come to South Africa where the life they face is grim. They often end up living in derelict buildings where there's no water, sanitary facilities or electricity, thus putting at risk their health and personal security.
There are a lot of people who live in these buildings who can hardly access, primary healthcare services, because basically most of them are migrants, and because they may not have legal papers to move around, they are afraid they may be harassed by the police, they may be harassed by even some hospitals or clinics may have a negative attitude towards them.
Médecins Sans Frontières set up a primary health clinic for these migrants, who are often turned away from the already overwhelmed South African health facilities because they don't speak the language or they don't have the money to pay for the consultations.
The main conditions that we see in the clinic, and also when we do mobile activities in the other buildings, is general primary healthcare conditions and very much linked to living conditions, such as respiratory tract infections, urinary tract infections, a high prevalence of TB, very high prevalence as well of HIV and opportunistic infections and other conditions related to HIV.
The migrants live in a state of permanent insecurity and uncertainty. Thousands are evicted, evictions that are carried out by security forces, including one known as the Red Ants, who use violence and intimidation.
The Red Ants are throwing things out on the street. We met just one woman who lost her asthma medicine that we had given her in the clinic a few weeks ago, and she was having a severe asthma attack at the moment.
We lost our big bags with all our clothes and groceries. But worst of all is my baby's health card. They refused to let me in and get it.
Many Zimbabwean migrants are attacked and raped on their journey into South Africa by the extremely violent gangs lying in wait on both sides of the border. But even when they reach Johannesburg, the ordeal is far from over. Without access to basic medical care, safety and shelter, the survival of these vulnerable people remains precarious and uncertain.
When militiamen came, they started killing and threatening people, day and night. They raped women too. It was unbearable.
Since the end of 2009, thousands of civilians have been caught between the military and armed groups in southern Ituri in the Democratic Republic of Congo. A few of these civilians did, however, manage to escape. By splitting up into small groups, they were able to slip through the front lines and reach Getty and Aveba, where MSF is providing them with crucial medical assistance.
MSF works together with the Ministry of Health. We are working in 4 regions mainly: the health center of Getty, the health center of Aveba, the health center of Chekele, and the health center of Olongba. Next to that, we have an emergency response in the health center of Soke, and we are trying to establish a response in the health center of Maga.
In this region, where access to medical care is extremely limited, it's essential that MSF tailor its medical response to fit the exact needs of the population. Humanitarian assistance is increasingly isolated. The general opinion is that the situation is returning to normal, despite the fact that the crisis continues.
But the problem what we see now is during 2010 there's a withdrawal even from other NGOs. There's limited interest in the zone by health authorities, which makes it for us that we're working partly as a development partner, partly as an emergency partner, and with only our presence it's very difficult to assure a decent level of healthcare for the whole zone.
Recently, fighting resumed in the Mukato Ngazi forest, once again trapping civilians. Caught on the front lines, they're unable to receive any assistance. Akon has her newborn baby in her arms. She gave birth at a Wheel hospital yesterday. Accompanied by her eldest son Wal, her sister and her mother, she's returning home where her other 3 children are waiting for her.
I wanted to give birth in hospital because I knew I'd receive better care if ever there were any complications. They took care of everything, even the drugs.
All went well for Akon, both during pregnancy and during the birth. But for complicated deliveries, mothers and babies are transferred to intensive care, like these triplets who are on oxygen.
Our main objective is to educate mothers and to help them during the first weeks following birth, so they'll be stronger when they're back home. Transport is the main problem, particularly during the rainy season. It's all right for those who live nearby, but access is a real problem for women who live far away. The mortality rate is high because often mothers get here too late.
In addition to the maternity unit, the paediatric ward treats children for numerous pathologies such as respiratory infections, diarrhea and blood poisoning. More than 3,000 children have also received treatment for severe malnutrition in this region where the disease has become endemic. In South Sudan, 86% of the healthcare is provided by NGOs. In 2009, more than 100,000 medical consultations were provided by MSF teams for children under 15 years of age and for pregnant women. And in the Awil maternity unit, nearly 3,000 deliveries were performed. This is Jigawa, a state in northern Nigeria, where the infant and maternal mortality rates are one of the highest in the country. 15 years ago, Hadija suffered injuries due to complications during childbirth. MSF teams have come to see her before she goes to the Jahun General Hospital for fistula repair surgery. Women suffering from a fistula become incontinent and often can't bear to leave the house and face people staring at them. In developing countries, many women give birth at home, which carries enormous risk in the event of complications. Fistulas are usually caused by abnormally long labour, when tissue necrosis occurs.
When there is prolonged obstructed labour, the longer it stays, the more damage it does to the tissue. So it can be just affecting only the bladder, it can extend to the rectum, it can extend into even some tissues within the vaginal area. So the more you wait, the more consequences and the more complications.
Hadija will undergo the operation at Jahun General Hospital, where MSF has set up a program focused on emergency obstetric care and fistula repair surgery. This type of surgery usually requires one, but can call for several interventions, followed by rehabilitation care. Within just a few weeks, women can return to a normal life in their community. In Nigeria, 400,000 women suffer from this type of injury. Since 2008, MSF teams have performed 280 fistula repair operations. In addition to that, every month, nearly 250 women, 60% of them presenting complications, give birth at the hospital in the best possible conditions of safety.
She will survive for sure. No problem.